It is no wonder people are confused about the health effects of alcohol, right? We see this range of headlines, we read them, like a drink a day is good for your heart, or studies show even moderate drinking increases breast cancer risk.
Yes, so we brought in Dr. Lisa Larkin. She's here this morning to help us go behind the headline, or beyond the headlines and behind them, to talk about some of these issues. So I read an article not too long ago in Mother Jones, where this woman talked about how she felt that she got breast cancer because she drank alcohol. So I got all nervous. So I'm glad you're coming in and talking about this. So does it cause breast cancer?
So I think let's set the stage. I think the public is generally aware about heavy drinking and the health effects of healthy drinking, where, to your point, it becomes very confusing is what's an acceptable limit of alcohol, and is there any acceptable limit, and what about moderate drinking? So I think people have generally heard something about the health benefits of moderate drinking, meaning 1 glass of wine a day may have some heart benefits. And so where is the safe amount of alcohol? And I think this is really the important point, which is maybe there's no safe amount of alcohol. I think the studies continue to emerge, and it is very confusing, that even low to moderate amounts of alcohol, 1 drink a day for women, 2 drinks a day for men, really does have health consequences. We actually know about cancer risk with alcohol. So certainly to your point about breast cancer, for years we've been saying that 1 drink a day is probably okay and doesn't really impact breast cancer risk. We now know the number's really 3 drinks a week, so far less than 1 drink a day. Breast cancer is not the only cancer that's associated with moderate alcohol consumption. Certainly colorectal cancer, oral cancer, esophageal cancer, there's negative effects of alcohol even in small amounts. And so in general, I really encourage patients to drink less, and I think under the current recommended limits of 1 drink a day for women and 2 drinks a day for men.
Does it make a difference what type of alcohol? Because you hear all this stuff about red wine or maybe beer for something else. Does it make a difference?
So unfortunately, it really does not make a difference. So the equivalent really is 1 ounce of 80 proof alcohol or 4 ounces of wine or an 8 ounce beer. And that's really counts as 1 drink. And really it does not matter what type of alcohol it is in terms of risk.
And so let's be clear, I think in the article, this woman that I read maybe didn't say that it actually caused her cancer, but it contributed. She feels that it contributed to her cancer. So we're not saying that alcohol can cause cancer, but it could potentially.
So what we think in looking at the breast cancer data is that about 100,000 cases of breast cancer per year could be prevented, right? That alcohol is associated with that. But for each individual patient, it's always very uncertain what was directly related and what caused the breast cancer, right? It can be, as we've talked about before, genetics, family history. It's always hard to sort out how much of that is environmental. But I think the message really should be that I think we should all be careful and moderate our alcohol consumption.
Are there other illnesses that can be tied to alcohol consumption?
Right, so there's all kinds of data now also about cognitive effects, long-term cognitive effects and earlier dementia. I think the heart benefits versus the heart disease risk, certainly hypertension is associated with daily alcohol consumption, and I think that data is a little bit confusing. Certainly women, excess alcohol is associated with more accelerated bone loss. So there's lots of things that even small amounts of alcohol are not great.
Pretty clear message from Dr. Lisa Larkin there.
Thank you so much for clearing that up for us.
Thank you for having me.